let's look into the CVP waveform. Any of us who have dealt with any patient in the cardiac ICU, I'm sure there's no way you can survive a couple of weeks without seeing a CVP waveform. So central venous pressure is the pressure that is measured from the right side of the heart, and the catheter tip, the central line catheter tip, is expected to be staying somewhere in a big vessel or the right atrium, and it measures the pressure on the right side of the heart. It gives you a lot of values, filling pressures, volume status. I mean, you can, if you're careful enough, you can actually observe valve functions or arrhythmias looking at this waveform. So a normal CVP waveform on a patient who has a normal heart function, a normal cardiac cycle, it looks like this. It has 3 upward strokes. It will be A wave, C wave, and V wave, okay? And then 2 descents. We call it descents, not downward strokes. It's called X descent and Y descent. So if you are the CVP waveform, the CVP catheter, and you are looking at the heart from this angle, okay? Here's your right atrium. So you're looking at it from here. Here's the patient's neck. The upward stroke is a positive deflection towards the catheter, and the downward stroke is a negative deflection away from the catheter, just for understanding's sake. So let's look into what these waves stand for, what these descents stand for. The A wave is the first upward stroke, and it is produced by the right atrial contraction. Very simple, A for atrial contraction. Okay, so the first upward stroke is atrial contraction. The C wave occurs. So what happens after atrial contraction? The blood is in the right ventricle now, and the right ventricle is going to undergo an isovolumetric ventricular contraction. What does that mean? Isovolumetric ventricular contraction means that there is no change in volume, but there is change in pressure. So during the isovolumetric ventricular contraction, the tricuspid valve on the right side starts bulging towards the right atrium, and it causes another upward stroke, and that is called as a C wave. So the C wave is for the tricuspid valve. If you want to remember the C for cusp, that's one way to remember, but that's what it is. So after the C wave, now the next thing that happens is the pressure within the right atrium decreases, because guess what happens? During the isovolumetric contraction of the right ventricle, the end of it, the pulmonic valve pushes the blood from the right ventricle into the pulmonary system. So that causes a tug or a pull of the tricuspid valve away from the right atrium, which causes a downward pull, which is called as the X descent. So the X descent is the pull or the tug of the tricuspid valve away from the right atrium during the right ventricular ejection, and that is called as the X descent. These are all board questions. So the right atrium, what happens now? The right atrium is empty, so it has to continue to fill during the late part of the ventricular systole, and that causes another upward stroke, and that is called as the V wave. So the V wave is another upward stroke during the late phase of the ventricular systole. Now the last wave that we need to look at is the Y wave, and that again is another negative deflection, which means when you look at the right atrium from the angle or from the point of view of your central line catheter, it's being pulled away from it. So basically it is the opening of the tricuspid valve and the blood from the right atrium entering the right ventricle. So that completes the cycle. This could be a board question, and it's very easy to remember and very easy to forget unless you review it every now and then.